So in this segment, we're going to be talking about how the government, successive governments, and the country have failed the NHS and healthcare staff specifically. So NHS staff in the midst of terrifying mental health crisis with 2 million days lost for mental health breaks. So it's a scandal of neglected NHS staff exposed as chilling figures show 300,000 are at breaking point with 2 million days off were recorded for mental ill health. So basically these are basically people who had to workers, healthcare workers who had to take a day off or time off because mentally they just couldn't handle all that was going on. The staff shortages, obviously dealing with COVID and death. I can't imagine that's easy to deal with. So it says here the NHS is battling a mental health crisis among staff, the second COVID-19 wave. Chilling new figures in a Sunday Mirror investigation revealed the terrifying toll on frontline workers dealing with stress, PTSD, and even thoughts of suicide. The evidence emerges as calls grow for Boris Johnson to stop failing our heroes, and they are our heroes. These are the best of us. People who go into medicine, people who go become doctors and nurses and other healthcare workers to help us. I think it was Santander who said it. How can a government refuse to care for a person that cares for a person? And that's true words are not spoken by most other rappers, because how bad is it that this government refuses to care for people that care for others? It's just shocking. Traumatizing staff for battling the terrifying mental health crisis as they fight to save lives in the grip of the second COVID-19 wave. Chilling figures today. This article from the 24th of October. There's more newer ones I've got in. What's it called? Traumatized staff are battling terrifying mental health crisis as they fight to save lives in the grip of COVID-19. Chilling figures today revealed hundreds of thousands of our heroes have been suffering, have been left psychologically scared and scarred by the deadly horrors of the first wave, leaving some suffering PTSD and considering suicide. And broken frontline workers today are telling tell how they feel about the government. And so these people have been abandoned. Healthcare workers almost 2 million days off for mental health illness in the first wave, more than the sick days clocked up by staff suffering from the virus. And you can see here this is a secondary effect of the coronavirus, but also the government underfunding. Nurses going into their shift 2, 3, 4 members short of a 24-member squad. How does that make any sense? We haven't invested enough into healthcare workers, and this argument that they don't have money is a joke. And you know what? Yeah, the stories only really get worse from here. And how do you get worse from mental health and suicide? We go here, NHS short of over £1 billion for COVID second wave and onset of winter. So the NHS has been given in excess of £1 billion less than it needs to tackle the second wave. I think the way they've worded this is a bit strange, and they should have worded this better. But the point still stands. They're £1 billion short of the target that they need. And we've got Dishy Rishi, handing out money to restaurants and all that, eat out to get COVID. Where's he at? Where you at, Rishi? More questions need to be asked about why the NHS is so short funded, considering that he said the NHS would get whatever it needs. Clearly, it needs more money and more staff. Rishi, sort yourself out, mate. So the disclosure raises questions about the pledge from, here we go, Dishy Rishi at the start of the pandemic to give the NHS whatever resources it needs. Hospitals across England face holes in their budget for the rest of the year of up to £20 million, which they say is hampering their efforts to prepare properly for the service's annual winter crisis and get back to pre-pandemic levels of surgery. And what's happening here is because there's so many shortages of staff and beds and all this stuff here, well, that means that routine care and other operations and other treatments get shelved to deal with people who are infected with COVID. And a tragedy is that if you need other kinds of help, you may not get it, not because the NHS is at fault, because they don't have the money or the facilities to deal with it. They don't have the staff to deal with other problems right now because the government underfunded them. 3 successive governments here. You've got David Cameron, Theresa May, and Boris Johnson. Never forget that it's not just Boris Johnson that's done this. It's the party itself. It's the Conservative Party itself. The situation has led to tensions between hospital trusts and clinical commissions. On the one hand, NHS England. On the other hand, the sums the latter was awarded to cover their costs for the rest of the financial year. So I think it's they're having big budget issues, and obviously if you can't pay staff that, or you have to go into debt, that's another problem. Well, the government will say the NHS is inefficient when it really isn't. It's the fact that they don't have the money in the first place to deal with a lot of the problems. So we keep going. NHS in England moves to highest alert levels. So the NHS in England has been placed on its highest alert level. Bosses have announced the move by NHS England means staff can be moved around the country while patients may be sent to other regions for treatment equipment if COVID threatens to overwhelm local services. So what that's telling you is that hospitals just aren't equipped to deal with it, and what that means is you may have to travel further for other kinds of care because hospitals' main priority is going to be COVID. And that's in part because of how bad the government have dealt with the pandemic, and also in part because they have underfunded the NHS massively, and therefore you're getting problems like this where people may have to travel further, you may not be able to get treatments for other problems you have. But also, and more importantly than just the ordinary person, is the fact that, you know, NHS staff that have PTSD, that are suffering with mental health, are not going to get the time off they need to, you know, deal with their problems, not going to get the help they need to deal with their problems. And so that means you're either going to get staff taking time off because they need to deal with their own mental health problems, which is absolutely, you know, no one can begrudge them for that. Or you might get staff who just have breakdowns in the middle of work. You know, this is just madness. This is absolute madness right now. And, you know, you've got here charities, you've got charities and things like that trying to raise money for NHS staff and hospitals. How does that make sense in a system where the government should be funding this? We have a national healthcare service that should be funded by the government, not through charities and not through, you know, people like Sir Tom and other people, you know, walking around their garden trying to raise money and things like that. It should be funded by the government. It should be funded by taxpayer money. And the fact is, you know, they've squandered so much taxpayer money now. The argument that they don't have the money doesn't make sense. These sorts of videos, they should not be needing to do this. They should not be needing charities to help them with PPE. The government should have dealt with this. Instead, they've squandered money and they've squandered time. They knew about this last year. They knew about this late last year, what's going on. Boris Johnson missing 5 COVID meetings. And these are the people he has failed. We go on, you know, coronavirus diary, we are the first-hand witnesses of this devastation. So the second coronavirus wave has already put many in hospital under great pressure, and it's nurses and physios who bear the brunt of it, writes Dr. John Wright. And, you know, here you've got loads of stories about from different healthcare workers. Would you go over this one quickly? From Moria Whitting, I think that's how you pronounce her name. It's getting very busy. It feels like it has reached capacity last night, and it looks like it's going to be worse. It's COVID on top of winter illnesses. As a team, I've noticed that we are bracing ourselves, and we are all coming down with aches and pains. We've talked about backache when we get home. There's just tension when we are all feeling it. The mood has changed. At the beginning it was, come on, we can do this, but now it's, have we got to do this again? And realistically, as all other countries are doing, you know, a lot of other countries in Europe have to deal with this again, and we have a second wave. But some of these other countries, like Germany, have dealt with it way better because they already had the facilities in place to deal with a pandemic, and also they were already prepared to deal with one. Our government has not been prepared to deal with one. It doesn't matter which Conservative Prime Minister it was, none of them would have been able to deal with it. And now we go into probably the worst ones outside of the mental health and suicidal, you know, thoughts that mental health care workers have been having. Their pay is not going to go up. After all of this, after how much have we realised these people, some of the most important people in the country, right? Their pay is going to be frozen. So public sector pay very likely to be frozen at 1% for at least 2 years. So a pay cap would see frontline workers, healthcare workers hit especially hard. Public sector workers are very likely to have pay rises capped at 1% for at least the next 2 years, according to a source close to the government. So, you know, take this with a pinch of salt. This very likely, you know, the government can say, oh, we're not going to do this. You know, we are going to give them some sort of raise, which probably won't be enough to cover, you know, just inflation. Forget, you know, giving them an actual tangible, you know, proper raise that they deserve. You know, we are in a difficult position. The government has to decide whether between pay rises for public sector workers or supporting the most vulnerable in society. And the thing is, they could do both because they've squandered so much money on things like test and trace, PPE and other areas. Their money is there. They're choosing to waste it and not to spend it in these areas. And that's what annoys me. You know, this argument, oh, we need to be careful of the deficit and the debt and all this stuff. Get lost. You've lost that argument. And if they don't get a proper pay increase, then, you know, I'm ashamed. I'm ashamed of this country. I honestly am. You know, NHS staff helped through crisis by a Wobble Room. So what that means is, you know, if you have, you know, a scare or you have some sort of you know, breakdown whilst you're working in a hospital, they have these things called Wobble Rooms where you can go in there, cry, and then go back in. So you know, there's a small room in the Derby Hospital. There's a table bearing a laminated sign. You are not alone. It says, this is the Wobble Room set aside not for patients but for frontline staff to get them away briefly from the intense pressure and strain experienced in the first COVID wave. We made a Wobble Room because that's what we needed. It's a room where staff can go in, sit and cry if they need to, and get it all out, and then come back with their face on and get back into it again. So what this is basically a room where, you know, staff go to cry and have basically a breakdown and try and get back in swinging things. You know, these sorts of things. It makes sense in a pandemic where things are bad, but you've got to remember this. You know, this situation has potentially always been there. for NHS workers because of the lack of funding, and this is the situation that's happening with them. They're having rooms where they can go and have a mental breakdown because they can't keep dealing with this. They can't keep dealing with the underfunding. The government's failure to deal with the pandemic. Eventually, a lot of these people are going to question, why am I doing this? Why am I doing this? Why am I dealing with this? This pandemic in a country where the government don't seem to care. And maybe they'll go to a country where the pandemic won't be as bad, they won't be as short-staffed, and they might get paid more. And you're going to lose a lot of NHS workers. And to be fair, I wouldn't blame them if they went. I wouldn't. We go to our final pieces, which is antibodies fall rapidly after infection. So here you can see from this article that they've done studies to say that if you have COVID, you develop antibodies to deal with the infection. Those antibodies quickly die off. And that means if you were impacted during the first wave, it means you might be impacted again during the second wave, which means the idea of herd immunity didn't work. And so what that means is you might be in hospital twice, once in the first wave, once in the second wave, maybe a few more times in between. And that means more pressure put on the NHS. I'm not blaming people for catching COVID. What I'm saying is that this government's failure to deal with the pandemic means that you may be infected more than once. You may need hospital care more than once. And, with the NHS not being able to deal with it, what happens then? I'll go to a final piece which really contradicts this one, where the government say there's not enough money. They spent 7 Gs a day on test and trace consultants. They spent $7,000 a day on guys who are a bunch of failures, and they haven't got money to give healthcare workers a pay increase. Get out of here. Get out of here. Anyways, I'm gonna leave it there. Let me know what you guys think in the comments below. This country is failing healthcare workers. Let's not get it twisted now. And it's time someone said something. I've had enough of people walking around gardens trying to raise money for charities and things like that. That's good. That's great. We do need that. But when's the government going to put the money on the table? When is the government going to put the money on the table and actually help these healthcare workers? The best of us. And if you're not angry about this story, then I'm sorry, you're not human. You're just not. Healthcare workers developing PTSD and other, psychologically scarred people that are scared. They didn't have the PPE they needed. They could have caught infections trying to help others. We saw so many healthcare workers die during the first wave, and no doubt that will happen again during the second wave. We're going to lose so many good people, in part because of this pandemic, but also in part because of the government's failures. But I'm going to leave it there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.